What we discovered is that healthcare today is outrageously reactive. If you're in the Medicare world, there's something called ABD. A is how much you spend on hospitals. Hospitals are the grand majority, the largest cost in healthcare today, followed then by Part B, which is mostly specialty fees. A large portion of that Part B, by the way, is also spent in hospitals during an acute visit. And then there's Part D, which is drugs. And so if you look at the inpatient volume and the inpatient costs from acute visits, plus the, let's call it the professional fees spent during that acute admission, plus all of the, what my dad would call the fruit from that tree, all the post-acute work, the rehab, the multiple visits, the lack of coordination, the readmissions, all that stuff, that is actually the majority of the cost of healthcare. And so the theory was, I wonder if we could spend a little bit more upfront and substantially bring down catastrophic acute admissions. And if you could create that environment, everybody wins. So here's the ChenMed model. The typical PCP takes care of about 2,300 patients under their panel. That's why when you go to your PCP, everybody's rushed, right? Because they're always in a rush because there's 2,299 other patients waiting for them. In the neighborhoods that my dad was looking at, that PCP to patient ratio is over 3,001. We said, why don't we go to those neighborhoods? Let's search out the oldest, the poorest, and the sickest. So this is that high-risk population that actually costs the most in healthcare. And can we deliver them a better than concierge medicine level of service and prevention? So our ratio is 400 to 1. Concierge medicine is typically 600 to 1. So you went from 3,000 to 1, concierge would be 600 to 1, and we're delivering 400 to 1. And the theory is if we could take that 400 to 1 ratio, give that amazing PCP a team that's trained, amazing technology that actually helps them manage their population through, not just in EMR, but also complex analytics. Could you substantially reduce the hospitalization rates? We provide our patients with transportation, door-to-doctor transportation. We provide them with on-site specialists. We provide them with on-site pharmacy services. And that cohesive, holistic approach towards prevention and towards managing the patient is what we deliver at a 4:1 ratio to that old, poor, sick population.
Hey, Dr. Faisal Syed here. Did you like this video? Be sure to subscribe to our channel by clicking here. And you might like these other videos. Click up here to watch more.